metabolized and into our bloodstream, and we want to focus on less than 50. So again, just starting the diet, and this is what we recommend doing for anybody who wants to start a diet. We find that people are more compliant and more likely to do the diet if you slowly get them on diet rather than immediately put them on a 3-to-1 ketogenic diet where the child's drinking, a pint of heavy whipping cream a day. We find that people quickly find that not very helpful for the child's quality of life. So that's why I'm emphasizing so much slowly getting on diet, slowly making some of the changes, because we're really focused on quality of life. And the reason, kids with Angelman love to eat, they get a lot of enjoyment out of food. And so our goal is not to be so restrictive that we take away some quality of life. So cutting out simple sugars, juices, soda, candy, processed sugars, cut out hidden carbohydrates like barbecue sauce, and you really want to start transitioning everything over to these low glycemic index carbohydrates. And so the low glycemic index is 40 to 60 grams of carbohydrates a day. And so here's a list of recommended foods, and the idea with this is not to read through them, but that if anybody wants these slides so that they can have this, I'm happy to send them to you so that you can have the full list. But you can see it's really kind of intuitive what things are good and don't increase your glycemic index. So, good. So protein foods, again, even though this is a high-fat diet, we don't want kids getting a lot of fat from the meat that they're eating because of the concerns about cholesterol. So we still focus on eggs, focus on lean cuts of meat if you're going to do beef, chicken or turkey. Dairy products you have to be careful with because milk has a lot of carbohydrates. So a lot of times we recommend trying to transition the child, depending on age. You wouldn't want to do this before age 2, but put someone on almond milk is a possibility. And you still want to make sure that they're getting plenty of dairy products because you want them to get the calcium from it, so you still want them to get cheese, yogurt, cream cheese. Vegetables, so you have to be careful with vegetables and fruits. Again, you really want to be looking at what is the amount of fiber in the fruits, for example, because that can be helpful in decreasing the glycemic index. We add a lot of oils, and that's really because we want them to get those good fats. So oils have good fats. MCT oil, I can't emphasize enough how helpful MCT oil is because I just see it help so many kids with constipation that I've just sort of blown away by it. But it really does augment these diets. And then drinking water is really important. So drinks are a huge source of calories for people, and a lot of us don't even realize that. So making sure that anytime anybody's getting drinks, that there's no added sugars to it. So that can be really helpful. So things that are not recommended, again, I'm happy to provide these slides rather than kind of read through it. But you want your child to get some good grains. So here, almond flour is good, coconut flour. And you want to avoid whole grains. So you have to be really careful about bread because some breads, even though they are listed as whole grain on the package, are not really whole grain and have a lot of carbohydrates. But there are some really nutty, grainy breads that don't have as many carbohydrates that would be in the low glycemic index. So there's a Dave's Killer bread, for example, that kids with, on diets can have. And so here's some sample diets. I'm also not going to read through this, but I just wanted you guys to have some idea of what a diet would look like. So, anybody? We always want to make sure that you're monitored by a physician and a dietitian whenever you're on these diets. And the reason is because you can have some complications to being on diet. And A lot of kids that we see that go all the way to the ketogenic diet, and if they go right to the ketogenic diet, they have a lot of issues with some of these complications I'm going to talk about. So we always want to be monitoring glucose, for example, because someone who goes from being on a standard American diet all the way to being on a 3-to-1 or a 4-to-1 ketogenic diet often will have problems with blood sugar. So the labs give us an idea of both safety of going on diet, but also the effectiveness of being on diet. So, and then just a note about transitioning kids to solids, because this is a question we get all the time. And so we want to make sure it's safe that kids go on solid foods. We get a lot of kids who come to see us who are being restricted from going on solids. So 6 months old, they're not yet sitting up. Their head control's not perfect, but it's there. We actually encourage families to just get the right kind of chair where they can strap kids in, where they can have support and still start solid foods. And so you want to start with purees. You want to monitor the child and make sure that if there's a cough or if there's signs that there could be something going down the wrong way, that you have that evaluated. And you can often go to a feeding therapist to get solids started. So one of the best things if you're on a diet or you're wanting to do a diet to introduce would be something like avocado or something like green, pureed green beans. So sometimes kids with Angelman have poor growth. It's actually relatively common. And so sometimes we're thinking about ketogenic diet maybe because the failure to thrive is actually also contributing to worsening seizures, which we see all the time. And so sometimes we'll start these formulas also to supplement whatever diet the child's on. And there's different products out there that are ketogenic friendly. So I'm going to switch gears and talk about kind of side effects, and I can't emphasize enough the importance of managing dehydration. So the more you get your child drinking water, the better off it is. Low blood sugar is common, especially if you're going immediately onto a pretty restrictive diet. And then some kids we see are very, very responsive to diet. So their ketones go up to really, really high levels, 150, for example, just going right on diet. And if that happens, we usually liberalize diet a little bit and come back to it. Metabolic acidosis, so increased acid level in the blood is fairly common, especially if individuals are dehydrated. So it can make gastrointestinal symptoms worse, and including vomiting early on when you're starting diet. So in particular, also constipation. So when you go on diet, it decreases the motility of things moving through your gut. So you want to be very aware of that, and that can contribute to the vomiting. That can also make constipation worse. And so one thing you can do to try to fight constipation if you're on a special diet or trying to get on a special diet is more fiber. MCT also is really helpful. And then there are a few cases of kids who have had inflammation of their pancreas going on diet, and so that's something that we want to watch out for. That's only really kids that I've seen who are on valproic acid, which is medication that we actually try to get kids off of if they come to see us for Angelman syndrome, but just something to be aware of. And then there's a risk of kidney stones as high as 25% in people who go on diet, and so you want to be monitoring. There's actually medications that can help prevent kidney stones, so I'll always ask families if there's a family history of kidney stones, and if I hear that, I may start potassium citrate. And then we also monitor this. We can monitor this with urine tests to look at the calcium to creatinine ratio, and I do that every 3 months. If there are concerns, I'll get a picture of the kidneys, so an ultrasound of the kidneys, to see that everything looks normal. And so growth and vitamin deficiencies, if you're on a strict ketogenic diet, are also relatively common. And so we recommend going on a multivitamin if you're going to try to do any diet, just for making sure you're getting enough calcium and vitamin D. We do monitor with imaging to look at bone density if kids have been on diet for a long time. And then the other thing is carnitine deficiency. So carnitine is a part of the body, it's a shuttle that actually is very important for getting your fat as energy into the muscle. And so a lot of times we can see that there's carnitine deficiency. And honestly, in kids with Angelman, sometimes we'll check if their parents are concerned, for example, about muscle tone that they feel like is out of proportion to other kids, or I'll check a carnitine level and I'll sometimes supplement it anyway if it's low, which can be really helpful. And then the other thing is that we have seen kids on the ketogenic diet actually get enlargement of their heart, and it seems to be related to a deficiency of a vitamin called selenium. So if you're on a multivitamin, you avoid that. Carnitine is a separate thing, though. It's often not in vitamins that you would get like a multivitamin. So we definitely see cholesterol go up in a lot of kids who are on diet, and so this is something that has to be monitored very closely. MCT and carnitine supplementation can be helpful to avoid this. And then just a few other considerations, because diet is so unique. So it is common for kids on the ketogenic diet to get dehydrated, so you want to make sure you're giving as much water as possible. So if they have a G-tube, you can just give water through a G-tube. A lot of kids, like I said, probably 99% of the ones that we see that we put on diet don't have a G-tube. And so you want to be constantly encouraging water. So a lot of times before kids can have meals, we tell families give them water first, and kids can learn that they need to drink the water before eating, and so that's been a very effective strategy. But you want to make sure, or flavoring it, like I said, with the frozen strawberries can be a good strategy, but you really want to get your child drinking water, and that's so important. Probably the number one reason kids with Angelman have constipation is that they're not drinking water. So that's something that we can try to change. So if they do become dehydrated and they come into the emergency room, you don't want the emergency room to give them fluids with sugar in them, which is what their instinct is going to be, especially in kids. So you want to make sure that you tell them, my child's on a special diet and I don't want them to get the sugar, because we've seen kids come in dehydrated, the emergency room puts them on a ton of fluid with sugar in it, and we have a lot of trouble stopping the seizures. So that's just something to be very aware of. And then there are certain anesthetics. So if your child's coming in for a procedure and is on the ketogenic diet, they also need to know about it, because commonly used anesthetics, like something called propofol, actually have carbohydrates in them as well. And then over-the-counter medications I mentioned already. So if your child has an ear infection, you want to try to get a medication that doesn't have a lot of sugar in it. And again, so fever is really important in Angelman syndrome. So you've heard a lot of talks. We even put kids on short-acting seizure medications when they're sick to try to avoid seizures. And so the other thing that you can do to try to avoid seizures is put kids on Tylenol. So if you do that, that has sugar in it. So we found that the suppositories really help. And then if fever is not going away, you want to go to the emergency room, of course. So I knew there was a talk in here before mine about ketogenic diet, so I didn't cover everything. And we have pretty different philosophies about diet between the two places in a good way. So I've left plenty of time for questions if people have any questions. Yeah, thank you for that comment. I would definitely agree. There's lots of options out there for smoothies, and lots of kids with Angelman like to drink smoothies. So, and I would put. Oh, wow. Mm-hmm. Yeah, yeah, that's great. And have you tried putting oils in it, like MCT oil? Okay, 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 yeah. So a lot of families are mixing it in with the heavy whipping cream, or mixing it in with pureed foods that they give their child, green beans, or I haven't had kids not take it though. However, a lot of the families that I follow, I started super early, and so maybe they're just used to it. But you give it as a teaspoon. I don't give a whole lot. So a teaspoon a day sometimes is all you need to help with constipation. I'm going to give you 1 second. But I want to emphasize also, so if you come to us for the study, we use the MyFitnessPal in the study, so we have all the families record everything that their child's taking in on the MyFitnessPal. So that is a great option, because it will tell you, you can have it calculate for you all the macronutrients, so how much fat they got, how much protein they got, how much carbohydrates they got. Yeah, if you use the coconut oil flavored, putting it on egg, I have families who put it in anything and everything. Yeah. It can, though, to your point, though, it can cause, like, refluxy type symptoms, which can be frustrating and cause people not to want to take it too. So if you put it on the right food, though, we've found that we don't have trouble getting kids to take it. Yes. Is that something that you can just get? All the health. I haven't found that. There's one that I like because it's cheap and it's coconut based, called Buried Treasure. But there's a lot of them out there. You can buy it at Sprouts. And yeah, it's not that expensive. Yeah, and it's very safe to go up on it. So I usually start low, because some kids do have an aversion to it or a little bit more reflux. So I usually start at 1 teaspoon a day. But, anecdotally, so there was a drug program at Nestle that was looking at use of MCT, which could increase the expression of UBE3A. So in normal mice, it was an observation of this scientist that when they gave MCT, it significantly increased the expression of UBE3A. And so they actually built a drug program around it that the scientists left, and they halted the program. And so there may be other benefits of MCT, which is one of the reasons I started using it. One, because it's helpful getting kids on diet and modifying diet, but two, just anecdotally, we haven't published anything, it maybe have other benefits too. Yeah. Uh-huh. Mm-hmm. Uh-huh. Mm-hmm. Mm-hmm. Yes. So, let me talk about that first. So one of the ways that we help with kids, and we encourage families, like if you want to be on a vegan diet, if you want to be on vegetarian diets, we encourage families to do that. And the one thing I say is to make smoothies. So add peanut butter powder to smoothies, lots of smoothies that have added protein to them, so the child's getting fats and proteins, but just in a different form than meat. That works. What was, your other question was about? Yeah. Good question. So this is my area of research. So yes, I think it is. But I don't have the data to show you right now, but I think one of the things we're studying with our nutritional trial is just looking at the groups of kids who enter the trial on diet. We're not putting anybody on a diet, though. So if you come for the trial, the focus is really on getting the exogenous ketones. So what we want families to do is we want them to stay on the diet that they're already on and have been on for the last 1 to 3 months, so that we're not having a change in diet while we're also giving a drug that should help increase the ketones. But we're measuring a whole lot of things. So we're measuring mobility. We're measuring, so, we're looking at the trajectory of mobility, and we're noticing that in kids with Angelman, there's a change in mobility around the time that they turn 10 or 11, particularly in the deletion subtype. So we're looking at mobility. We're looking at measures of cognition. We're looking at going to the bathroom and impact on constipation. And we're looking at seizures as well. So we definitely think there are other benefits. We don't have data to support it yet. But in some of Dr. Thiebert's papers, if you look at the fine print, there's a couple of, in particular, comments about this may be helping developmental milestones. So I do think there's other benefits. And so young kids who come in that don't have, children who don't have seizures, and there's a good proportion of individuals with Angelman that don't have seizures, we will encourage families to start to go in the direction of diet. Yeah. Mm-hmm. Mm-hmm.
We're very consistently getting her healthy fats. Her appetite's more controlled. She's just in a better mood. Just lots of her seizures. She still has them. Like I said, she's not done 100%.
Mm-hmm.
But they're not as long. They're not as severe.
Mm-hmm.
Little things like that. But the one thing that we haven't tried, what she mentioned, is like the Carnitine.
Mm-hmm.
Is that a good supplement to add in, even if you're not like one of those specific diets? Could that be beneficial?
That's a good question. Yeah, it's a great question, and thank you for sharing. I would say that's our experience too, that you don't have to go crazy, you don't have to go totally restricted, but the more you clean up the diet, so getting rid of processed sugars, like was said, getting, cooking everything yourself, which I know is hard, but the more you clean up the diet, the better off they do for sure. And I should say, what we say in clinic is clean up the diet in this direction. So clean up the diet, also eliminating sugars, eliminating lots of high carbohydrate, even if you cook them, foods, and moving more towards thinking about what foods do to your glycemic index, and that helps kids with Angelman a lot. Carnitine is a hard one to answer. We usually measure the level There are other disorders that cause low muscle tone that it's used for commonly. Sometimes we have families come in and they really want to try supplements. It's very safe to try it if you want to. Certainly, I do put people who are doing diet on carnitine along with the MCT. Yeah.
So does carnitine also help with the low muscle tone and the digestive tract, and not just, the bigger muscle groups?
We don't have any data to know for sure the answer to that, but it's not something that's hurtful usually. The main thing would be some of the experience with MCT that was shared is that it can make kids not want to eat what you're giving them when it's in there. It can cause some reflux. So if they're having side effects of it, I usually stop it. But anybody who's going on diet should be on carnitine supplementation. Yeah.
I was going to mention, my son is 18, but he was having horrible seizures and so, we tried several medications, and at that time, 2004, I really didn't have a whole lot of options. It was great medications for especially atonic seizures that he was having. So, we happened to have our neurologist working with a dietitian who was using ketogenic diet, and this kind of seems to help with seizure disorders. And we've had dietitian working with us, and we got on the ketogenic diet. And in 2 weeks, my son stopped having seizures and started walking on the
Mhm.
and we were sold. It was like,
Mhm.
it was a hard thing to do, but he could still love to eat, and he was already loving food. And he had a dairy allergy, which was another obstacle, trying to diet and have a dairy allergy. But he could do high-fat dairy, like whipped cream and
Mhm.
butter, and he had coconut and yogurt.
Mhm.
So we did a whole lot of stuff with him and doing that thing. But we felt like, because he wasn't having the seizures that we needed to fight, he just developed so much. And we just felt like his developmental ability just grew up. Like,
Mhm.
and he was in therapy, we didn't want to, but I don't know, the impact of it was incredible. And so we did it, we stayed on it for actually 4 years. 3 years fully ketogenic diet, and then tried to wean him off for a while to get to see where he would be without it. And then we had Carnitine added just like a minimal amount
Mhm.
to kind of impose seizures, and he had stayed on that exact amount for like
Mhm.
2 years.
Yeah.
So he barely had seizures. I felt have maybe a bit about this. Usually like he's fighting cold.
Mhm. Yeah. And I guess the question is, was he having more seizures, like subclinical seizures that the diet helped that was impacting his development, or is the diet in of itself impacting development? The other problem with my study right now is that I don't know if I'm using the right markers to pick up changes in development well. And that's the problem with all the studies right now, is trying to figure out how to measure these things. But definitely, anecdotally from our clinic, we see kids achieve developmental milestones sooner, it seems like, when they're on diet.
We're seeing options now.
Yeah.
Simpler things.
Mm-hmm. Yeah. Yeah.
I'm sometimes confused, so on the ketogenic diet, the brain's going to use ketones, and that's associated with seizure reduction.
Mm-hmm.
But on a low glycemic index treatment, and especially, I know they talked about modifying that for children that don't necessarily have seizures, is the mechanism more that the blood glucose levels are stable? And because I don't assume they don't get into ketosis on a low glycemic index diet, is that correct?
That's a good question. So when you measure ketones in individuals on the low glycemic index therapy, some of them do go into ketosis on it and some of them don't, and I don't know the difference. Maybe it has to do with how restrictive it is in reality. But it still probably has the same mechanism because we can't measure what the brain's doing. And so I think that there probably still is some impact on the circulating neurotransmitters because you've really changed over the, the, the food that the body's processing, even if you're not able to measure the ketones. Yeah. Yeah. We see a lot of kids in ketosis. In fact, it's been hard to find families to participate in the study who are on the true ketogenic diet, and a lot of them on low glycemic index therapy, where we're measuring it very closely. They are producing ketones, yeah. But not all of them do. Yeah, it doesn't seem to. From the data that we have, the low glycemic index therapy in Angelman seems to be just as beneficial as a ketogenic diet. The only time we use a ketogenic diet for sure is for someone who has bad seizures, and then we do notice a difference. We can notice a difference when someone's having hundreds of episodes of seizures a day.
I just want to comment that my daughter started having seizures before diagnosis in the hospital. Once we started, we actually started the diet before we figured out her true diagnosis. We played around. We did not go to dietitian. I did not want to go to the keto diet because it's so severe. And so we've been playing around with the low glycemic diet and just figuring out. And so little things like after dinner we were on food. And that was purely input actually from my Pilates instructor because she's like, well, sugar, not really good sleep. So yeah, so we decided to give her nuts instead, and that made a difference in her sleep. So, and I mean, we never exactly measured, percentages versus fat. We just know that for snacking, we're more likely to give her nuts versus, something else. And it's tremendous in terms of what we believe. And she hasn't had a seizure like what she used to have since she started the diet. She has very, very low amount of Keppra, and her cognitive and all of the other developmental progress has been really just massively needed. It could be, partially because of the aggressive therapies, but really a large part is because of the diet. And I'll tell you, just me following a little bit along with the diet makes me feel better. So I know that if it makes me feel better, then just overall, even if it's not, doing all the natural things that it's definitely improving just the overall health. So I'm a huge fan, and I would absolutely recommend it for people, not necessarily having to do exactly what is prescribed, but just based on your individual circumstance.
So I will say that that's really our philosophy in clinic, is that we're really focused on quality of life, and the people that we put on the ketogenic diet, we notice that their quality of life goes down significantly because, think about just things like being out and not having something with you. It's very, very difficult. And so we really just tell families, like, these are the kind of the guidelines and loose principles that we recommend, and then, make it the best it can be for your family. And so that is really important.
Comment because my daughter's 14 with Angelman, and we've changed her diet since she was 5. So I forgot this one thing, but when we initially changed her diet and cut out more of the carbs and that, we were giving her a lot more eggs. And then she started having a rare type of seizure that was one-sided and left her paralyzed after. And then we went to see like a nutritionist, like a functional medicine kind of doctor, because we saw regular dietitians. And I said, I think I'm giving my daughter more of something. And because it was shortly, about 6 months after we changed her diet, that she started having this really scary type of seizure. And so I took her to somebody who did other testing, and they did like an elimination diet for food sensitivities. And we found out that it was eggs. And she'd always eat eggs, but for whatever reason, we had to stop them completely because of that. So I just want to also mention, I feel like our kids are really sensitive to food. And so also just if you make sure to write down what you're feeding them and how much, because with my daughter, it started as like kind of a seizure for her, and it's
Mhm.
We have to be really careful with that. She can't have a lot of the carbs, but she eats a lot of fresh, not cooked, but like fresh vegetables.
Mhm.
And we do a lot of like smoothies and stuff like that so that she gets enough of those fresh vegetables, which help with the constipation and all those things. So if you're like writing things down before you change your food and then watching that to see them, because it took me a little while to figure out what food it was that was causing us.
I think that's really true about Angelman is everything seems to kind of be related. So the constipation and the sleep and food allergies, it can all be related and make another aspect of Angelman syndrome worse, like food allergies that cause bad constipation can cause more seizures. So yeah, being really in tune to and trying to keep to routine can really help. Yeah.
I'll make a comment with some MCT oil stuff. If you have a dietitian and see it, they'll prescribe it for you.
Yeah.
Our private insurance going to pay for it, but to stay supplemental with it to cover the MCT oil and the
Yeah. If you play with the diagnosis, you can sometimes get it covered for sure. Yeah, that's the key. But yeah, those are both carnitine too. Carnitine is something that is available for certain genetic disorders that have to do with how your body's ability is to use the carnitine shuttle, so use the energy from your fats to get to your muscle. And so you can get that covered by insurance. And the other reason to prescribe it, even if you can't get it covered by insurance, is of course then you have something that's regulated. No, yeah.
So is the only time that you even measure your ketosis if you're having seizure activity, if you're trying to make sure that you get into ketosis after reset, other than that, you don't have to worry about measuring?
It depends what kind of diet you're doing. We typically don't recommend measuring ketones because we're doing more of these are the principles, let's, slowly change over your child's metabolism, and we don't usually measure it. But in the instance where a child's having hundreds of seizures a day and you're going on diet, you're going on a strict diet because you want to reduce seizures and quickly, we would ask families to do keto sticks at home and measure it in the urine and come in and get lab work regularly to measure it. Yeah.
So you look at a nutritional chart, total carbs are 10.
Mhm.
One's dietary fiber, one's sugar. What are those two other things that they don't tell you?
You mean like on a food pyramid?
No,
Oh.
inside the box, you look at nutritional factors, this many calories in a serving. You look at carbs.
Oh, food label. Okay.
Sugars, and they never add up to 12. So what are the big ones?
So the rest of it is so there's different types of carbohydrates. So sugar is definitely in the category of carbohydrates. And the reason they tell you how many sugars is that the Food and Drug Administration requires them to tell you how much sugar is in the content. But there's other types of carbohydrates too. So different types of coatings on food, and bread is not just all sugar. There's other types of carbon chains that are types of carbohydrates, but they're not considered sugars because they don't have the right groups on them. So it all has to do with the chemical structure of the sugars, and a carbohydrate has a certain number of carbon chains. And so there's many different types of carbohydrates in terms of the building blocks of, and sugar is one of them, if that makes sense.
And dietary fiber.
Fiber is also required by the Food and Drug Administration to be reported because there's an RDA, so routine daily amount that the FDA requires of good nutrition requires if you're looking at your food pyramid, and so that's why they report that out. But all the other carbon chains that don't have the right groups to make them sugars are what else is in there. So, for example, vegetables are actually carbohydrates. They're just a nutritious carbohydrate, as opposed to sugar, which is, for lack of a better way of saying it, kind of a bad carbohydrate. Thank you for coming.